Trichlorfon is an organophosphorus compound that is used as an insecticide and acaricide. It is a colorless to pale yellowish liquid with a slightly sweet odor. Trichlorfon is a cholinesterase inhibitor, which means that it interferes with the normal functioning of the nervous system by preventing the breakdown of the neurotransmitter acetylcholine. This leads to overstimulation of the nervous system and can result in paralysis and ultimately the death of pests. Trichlorfon is used to control a variety of insects and mites in crops, as well as to control pests in livestock, poultry, and fish. It can be applied as a spray, dust, or in a variety of other formulations. Due to its potential toxicity to humans and other non-target organisms, trichlorfon use is regulated in many countries. The side effects of trichlorfon can vary depending on the level and length of exposure, as well as individual factors such as age, gender, and overall health. Some of the most common side effects of trichlorfon exposure include 1. Nausea and vomiting. 2. Headaches and dizziness. 3. Blurred vision and eye irritation. 4. Difficulty breathing or shortness of breath. 5. Muscle weakness or twitching. 6. Abdominal pain and cramping. 7. Diarrhea or constipation. 8. Seizures or convulsions. 9. Coma or loss of consciousness. 10. Skin irritation or rash. Exposure to high levels of trichlorfon can also result in more severe symptoms, such as respiratory failure, cardiac arrest, or death. Long-term exposure to trichlorfon can also lead to neurological and developmental issues, including learning disabilities and behavioral problems. It is important to note that some people may be more sensitive to trichlorfon than others, and the effects can vary depending on the method of exposure, such as inhalation or ingestion. Anyone experiencing symptoms of trichlorfon toxicity should seek medical attention immediately. If you suspect you are experiencing any side effects or symptoms of trichlorfon exposure, it is important to seek medical attention immediately. Treatment for trichlorfon toxicity may include 1. Activated charcoal. This is a type of treatment that involves ingesting activated charcoal, which binds to the trichlorfon in the digestive tract and prevents it from being absorbed into the bloodstream. 2. Atropine. This is a drug that can be used to counteract the effects of cholinesterase inhibitors like trichlorfon. Atropine works by blocking the activity of acetylcholine, which helps to reduce the symptoms of trichlorfon exposure. 3. Pralidoxime. This is another drug that can be used to treat the effects of cholinesterase inhibitors. Pralidoxime works by restoring the activity of cholinesterase in the body, which helps to reduce the symptoms of trichlorfon exposure. 4. Supportive care. In severe cases of trichlorfon toxicity, hospitalization may be necessary. Supportive care, such as oxygen therapy or mechanical ventilation, may be used to help support breathing and other vital functions while the body begins to eliminate the toxin. It is important to note that the best course of action is prevention. Trichlorfon is a chemical compound that belongs to the organophosphate class of insecticides. It is a white crystalline powder that is used to control various types of insects including cockroaches, fleas, ticks, and lice in both agricultural and domestic settings. Trichlorfon works by inhibiting the activity of acetylcholinesterase, which is an enzyme necessary for the proper functioning of the nervous system in insects. Without this enzyme, the insects experience overstimulation and paralysis, ultimately leading to their death. While trichlorfon is effective against a wide range of insects, it can also pose risks to human health and the environment, particularly when used improperly or overused. Therefore, it is important for individuals to use trichlorfon-based products strictly according to the instructions provided by the manufacturer and to take all necessary precautions to reduce exposure. Trichlorfon is not currently approved for use in cows in the United States. In some countries, it may be approved for use in cattle for the control of internal and external parasites. If trichlorfon is approved for use in cows in your country, it should be used strictly according to the instructions and recommendations of your veterinarian. When using trichlorfon in cows, it is important to follow best practices to avoid overuse or misuse, which can lead to adverse health effects. Some general tips for using trichlorfon in cows include 1. Determine the appropriate dosage of trichlorfon for your cow based on the animal's age, weight, and overall health. 2. Administer trichlorfon as recommended by your veterinarian, taking care to follow all instructions provided, including the method of application. 3. Store trichlorfon in a cool, dry place, away from children, pets, and other animals, and follow proper disposal procedures for unused or expired product. 4. Monitor your cow for any adverse side effects, such as vomiting, diarrhea, respiratory problems or excessive salivation, and report any issues to your veterinarian immediately. Again, it is important to consult with your veterinarian before using any pesticide or other chemical treatments on your cattle to ensure that it is safe and appropriate for your specific situation. Thanks for watching. It's Nature 100M Present.